It's just not fair that young kids are having to deal with these types of diseases that generations ago didn't even exist unless there was some other medical problems that were going on. And the beautiful thing is you can turn it back much faster, generally, than the time it took for you to get there. Chronic disease is on the rise, metabolic diseases are on the rise, obesity is hitting younger and younger generations. Yes, extending life is great, but extending quality of life is more important.
Hi, everybody. Welcome to another exciting episode of Biome Breakthroughs. And today we are jumping into the headlines. And if you haven't been recently Googling what your food pyramid looks like, well, this episode is for you because we're going to cover a little bit about the changes to the food pyramid that have recently been released by the US and talk a little bit, kind of focus in on diet and why it's so important and why we think this shift might be happening from a microbiome standpoint. So if you haven't been looking recently on the changes to the new food pyramid released by the USDA and the Health and Human Services departments in the US, the idea was originally they had moved away from the food pyramids and got into this idea of plates of food. And kind of the idea was, eat well versus being dictated by what foods are more important than others in terms of the pyramid style. And so this new kind of dietary guidelines that have just been released kind of moves back to the older format of a food pyramid, but it's actually inverted from the way that it used to be. So the larger parts are at the top. From a visual processing standpoint, this makes more sense because it used to be basically the bigger part is what you should eat more of. Now the idea is you're feeding from the top down versus from the top up. And it's a little bit more focused on whole foods, proteins, and fibers. And if you've listened to any of the other episodes, at some point we have talked about whole foods and fiber. So I think this kind of aligns with that. So now that we've kind of cut you up a little bit on what the bigger shifts are, from an overview standpoint, Jason, what's your take kind of on this shift to the food pyramid again and the changes?
Yeah, I think it's a good sign. If you look at public health to make decisions and you see that chronic disease is on the rise, metabolic diseases are on the rise, obesity is hitting younger and younger generations, there's just a lot of signs that something is off. And so I think it's prudent on healthcare providers, of course, at a community level, but a government which dictates these policies to start to take a look at things and say, all right, did it work? We made a shift at X time. Where are we at today? Is our health better off or is it worse off? And by most measures, we'd say it is worse off, although there are potentially some measures that I'm not thinking about. And technology advancements, of course, like better surgery or better medications have for sure extended life. But a lot of, again, what we discuss is, yes, extending life is great, but extending quality of life is more important. And our healthcare, or what many will term as sick care, is it's not great. It's not supportable. We can't continue to support it here in Canada where we are, or in the US. It's failing in many regards. And a lot of skeptics of the original, the previous food pyramid, were really putting a lot of emphasis on, well, these were designed by companies that were making the products. So there's a lot of, Washington, for example, is full of people who are trying to advocate to allow their companies to sell more stuff. And so if you're General Mills, for example, you're very happy to see wheat and wheat products at the bottom of this pyramid, and hopefully encouraging people to eat more wheat. And it's not to say that wheat is bad. The trouble is just that when you have a diet where you have easily digested carbohydrates, generally they're, packaged up, including a lot of sugars and dyes and other processed, things in the food. What ends up happening is you create a cycle for your body that's not healthy broadly for your metabolism, but also for your gut microbiome, which is, what we're all about. And so when you continue to eat high carb foods with frequency, you create this like yo-yo effect where your body has to keep producing insulin to allow those sugars to come down and push it into the cells. And this yo-yo effect has an effect on your stress hormones, stresses your adrenals, and your body needs to continue work to manage this blood sugar, spike, dip, and that stress through your body, even though it's, happening day to day all the time. You're not like aware that there's some stressor, but that continued stressor it has an effect on your gap junction. So your gut lining, the wall, contains 3 levels of cells. Like, it's not very deep. And what happens when you're under stress, both, from your environment, but also from your food, it causes those tight junctions to leak. And so we get what we call leaky gut. And now you have inflammation leaking through the rest of the body. And that's, the environment that sets up some of these more chronic diseases. And so focusing on this newer pyramid where you're doing a higher protein diet along with more whole foods, which would include fruit and vegetables, you're not going into this cycle where you're causing more of the blood sugar spikes and dips, the stress, and the stress again on the gap junctions. The other thing is by focusing on this, and this is another sort of category, is that high carbohydrate diets really push fungal overgrowth. If you're eating too many carbs, it's feeding the fungus, and that shifts the microbiome again towards a more inflammatory state. And so you're reducing the amount of bacterial communities, and you're increasing the number of fungal communities. And when that happens, you're then removing the byproducts that are produced by these bacteria, which could include short chain fatty acids that are very anti-inflammatory and help feed, again, these tight junctions, these cells that line the digestive tract. So the combination of those two things, I think, moving away from higher carbohydrate and to a more protein whole food, will in time definitely have an effect on the microbiome, and hopefully for those patients who aren't too damaged, allow for a more balanced microbiome.
Yeah. And I think this shift towards whole foods and eating kind of a more diverse, like, I think it's really cool to see, it's kind of all mixed together, which is nice. I always love, it allows for more interpretation, but there's a same emphasis on plant-based proteins as there are fish and red meats and chickens and things like this. But because we know that we want to eat across both animal and plant-based proteins. And when we're looking at kind of emphasizing fiber as a whole food in terms of, with where else you can get fiber, and not just as a supplement added into your day-to-day, because everyone knows fiber is important. But fiber isn't just about processing. There's benefits for fiber on its own. And so I think bringing that back in and kind of using, I think, food science or our understanding of the importance of food and seeing food as fuel for our body and our microbes, and then reflecting that in what we're suggesting for people to eat is really key. It's going to also allow for more beneficial bacteria. And like you said, like this kind of increase in short chain fatty acids, because that's what these foods are going to do. And moving away or kind of emphasizing how much else you can eat outside of these ultra processed foods with a lot of added sugars. And, that's key, because I think we've become more processed in terms across all of our food, but as well as the ease of food. And so I think kind of reimagining what food's going to look like, I think it's a really important time to do it, because we've got so much information now from a gut health science standpoint, and now seeing this reflected is really positive, especially the increased emphasis on, vegetables, fruits, and whole grains together, talking about healthy fats, touching on the balance between animal-based proteins and plant-based proteins. All of these things are all the things that science is screaming about the importance of, and then seeing that reflected in, like, from a government release is really nice, because not always does science and these kind of things hold hand in hand. So
They do not. They do not.
seeing it, in real life. So that's kind of exciting from my standpoint.
Yeah, and onto the fats thing as well, right? I mean, there's so many things that can have a negative detrimental impact on the gut microbiome. I mean, you name it, from everything from being C-section born, antibiotics, all the environmental toxicants that were, in food, on our bodies, that whether it's shampoos or creams or, it just, the list goes on and on. The PFAs in plastic. I mean, it becomes a full-time job just to manage the environmental exposure. But the fats being one of those, right? Like, if you're eating fats that, these vegetable oils, and there's some that are better qualities than others, that's a whole nother discussion that we won't, belabor today. But those can, again, be more inflammatory to the gut and the microbiome. And so anything that creates inflammation damages the gut microbiome. And, again, you get into this cycle where you increase inflammation. All disease is inflammatory based. I mean, it doesn't matter what you're thinking about. It's all inflammatory based. And the great thing is that inflammation in an acute situation is good. You want that there, right? Like, just imagine an ankle. Someone sprains their ankle, inflammation. It gets puffy, it gets red, it gets warm. The body's bringing in all this, resource to help heal that ankle. The trouble is, as an example, in arthritis, the inflammation doesn't leave. And when you have inflammation over a long enough period of time, you start to get a breakdown, a degradation of that joint capsule. Everything starts to break down. It eats itself, basically. And that same concept can happen in basically any organ system, including in your gut and your gut microbiome. And so prolonged inflammation kills the microbes, damages the gut lining, and now you start to get body-wide inflammation because the gut kind of contains it, right? Like, it's meant to contain it and deal with it. You have the liver and the pancreas and the bile acids and everything working together in a way to move stuff through, digest it, absorb it, utilize it in a healthy, meaningful way. But when that inflammation is prolonged, the gut can no longer contain that, and it starts to leak out and have a body-wide effect. And what's very intricate and linked to the gut microbiome is our whole lymphatic system. So most of our immune system is tied around the gut through this gut-associated lymphatic tissue. And when you have enough inflammation over a long enough time, it starts to change the balance of our immune response. So we go away from a balanced system. Again, everything in our body wants to be balanced. Our microbiome, our pH, our it's measures of CO2 and O2. Everything wants to be balanced. So does our immune system. But if you have prolonged inflammation, you tilt the inflammatory response. The body's like, we're under attack. There's an invasion. There's a problem. And over a long enough period of time, it reprograms it. It starts to think like, okay, we got to get into a different phase. Something's wrong. And that's where you get the shift between a Th1 and Th2 balance that can then set off inflammatory diseases, including autoimmunity. And so we have to work backwards, right? We can't just be thinking about this like, oh, I have Hashimoto's, thyroiditis, or I have, ulcerative colitis. Like, we don't need to just think about the diseases. This is the expression of the symptoms. If we peel all these layers back, what's the foundation of it? And for some people, the diet is going to be the thing that you can shift that, and you could peel these layers back, prevent these diseases from even happening. But for success in restoring the microbiome, the diet is by far the thing that results in the quickest change. I think you've talked about this before, where a dietary change today, like shifting your what you're eating, maybe just a more high plant-based, more, fibers, will tomorrow shift your microbiome to a healthier pattern. So it's the thing that results in the quickest change and is the most durable over time. There's going to be cases where the degradation that you've lost completely keystone species because of antibiotic use, or this inflammation has been going on far too long. And that's where, potentially restoring the gut microbiome with a fecal microbiota transplant, which is what we're all about, might make sense. But a significant majority of the population can totally reverse their disease through considering the microbiome and what's healthy for it and what's not healthy for it. And if you start to work backwards from that, there's going to be a huge shift in health, right? Like, anything that will support the microbiome will support your health more broadly.
Yeah. And I think we talk so much about, generally in health, about the importance of genetics and kind of what's predetermined. And one of the cool things about the microbiome is diet is more important to how your microbiome looks than your genetics. So, like, you can get up today and start making improvements. And if we look at how integrative, functional, homeopathic medicine is looking at disease, the number of starting points, let's first look at what you're eating and how can we change it to get your body out of this inflammation state or out of this cycle, has blown up. If you go on the TikTok and you look around for a couple minutes, you'll find at least one video about it, because it's so key, because it can make changes quickly. 24, 48 hours, you're seeing a shift, and nothing does that. Nothing makes a change that quickly. I think another big thing here is like, why, or from a mechanistic standpoint, how does diet change things? You increase how much fiber you're having and the diversity of that fiber, you increase how much short chain fatty acids you're having, you help to restore your gut barrier. You eat bright, colorful foods, and that's kind of the pretty part of this new pyramid. There's all these colorful plants and fruits in there, but those have polyphenols in them. So those help shift your microbiome. You reduce your simple sugars and you reduce what you were talking about, like yeasts and fungus overgrowth. All of these things you change and you get an outcome. That doesn't happen in everything with these huge major shifts happening quickly. And so thinking of food as a way to restore or heal is really important here, because if you're at the beginning of starting to see symptoms, you're starting to see brain fog, you're starting to feel sluggish, or you're starting to feel like you're more reactive to everything. Because a lot of times when your body's in an inflammatory state, you'll start reacting to stuff you didn't. Your body had the ability to kind of offset some minor reactions you would have. But all of a sudden, cream you used to use, you put a cream on that you used a month ago, and all of a sudden it's burny or ouchy or it doesn't feel the same. Well, that's probably because your body's already busy doing something else. It can't offset that mild reaction you were having before because it's in a heightened state. And so this is something we see a lot. People complaining a lot about, like, I just feel like now I'm allergic to everything or I'm reacting to everything. Well, there's a reason that your body is in that state. Can you imagine if you started evaluating what you were putting into your body and how that was contributing to that, and start shifting that thought process in terms of if I'm going to eat one thing today that's most beneficial, what's the thing I'm choosing today? And tomorrow eat that thing and the next best thing, and build up how many of these good food choices you're making. And it can be one or two foods at a time. And then you keep adding to that. And instead of it being an active process, it becomes natural habit. And that's
Right.
part of, we have to tap into our brain's ability to love habit. So let's make it gamify it. How many can you eat? How many can you eat a week? We love games. We love rewards. And build it. Like, let's start with, I'm going to eat 10 different foods this week. I'm going to eat 20. I'm going to eat 30. I'm going to eat 50. Look how great I'm doing. And then make it habit, because I have to eat an orange food every day. I've got to eat on Monday, Wednesday, Fridays, I eat one thing that's orange. On Tuesdays, Thursdays, I eat something that's green. Like, make it fun and then make it a habit as you build it.
Right. And just as you become sick and chronically ill and get symptoms and disease, the building blocks are the same, right? Like, it's generally, I mean, there's exceptions, of course, and there's things completely out of our control in some cases, but we're taking a big, broad stab at this. Like, this happens slowly over time. You're maybe you weren't aware of it, but the bad choices over time all build up and compile on each other. Some are choices, some are just life circumstances. Like, you couldn't choose if you were born to be a C-section. Wasn't your choice. Might have been a medical thing, might have been just a preference thing, right? So there are certain things that are definitely out of our control, but way more in our control than out of our control, especially if we're adults and we can choose what we eat and so forth. And so that's the same. The pathway is the same. You got sick through a series of life circumstances and choices, and you can unwind that. You can turn it back. And the beautiful thing is you can turn it back much faster, generally, than the time it took for you to get there. Like, a lot of these chronic diseases took 20 years, but it was a slow and gradual, presentation where it's like, you start having some skin issues, and then you start having some, like a little bit of brain fog, and mentally I'm not quite as clear as I used to be. And I have a little bit of anxiety, and like, these are all the signs your body's trying to give you. It's that dashboard idea, right? Like, the lights are coming on. And in many cases, unless the vehicle won't start, people are ignoring them far too long. And so this is the same process. You reverse all of this through changing some of the choices at this foundational level, which starts with the diet and the types of foods that you're eating. And these incremental small changes will build on top of each other, and can quite dramatically, quite quickly change some. Like, type 2 diabetes can be reversed. It absolutely can be reversed through diet and lifestyle. There's a lot of people they don't believe that. They haven't seen that as a reality. And then, of course, we're talking about diet, but there's a lot of other factors that come into health, right? Just exercise being another perfect example of very quick change to our health, very quick change to our microbiome status. And so there's a lot that goes into this, of course, but the encouraging part is you can reverse a lot of these chronic things through very simple changes. And this pyramid inverted on itself is an indication, right? It gives us an idea of, okay, here's how we need to switch and change this. And we need to move it from big government, someone who's directing change, to individually, what can I do today to make a change? And from a healthcare provider standpoint, and to the healthcare providers out there, talking with your patients about how this affects the microbiome and how this is so critical to their overall health and well-being, right? I mean, this pyramid is not talking about the microbiome, but the good news is, from people who are in the space, hello, it has a real obvious impact. And so other healthcare providers out there, let's spread this message of changing to a more whole foods, more fibers, more healthy proteins, and away from this carbohydrate focus will absolutely have a positive impact on the gut microbiome. And the gut microbiome, and the microbiome in general, is the foundation of our health and well-being, and sets up, either positively or negatively, for the presentation or eventual onset of disease. So yeah, I'm excited to see where this is going, but I hope people individually and healthcare providers can get behind on the education part and start to enact change, both themselves and for their broader communities.
Yeah. And I think one of the real key points to hone in there on is looking at health in terms of what you can actively do. I don't know how many people will start with like, well, the key is getting less stress, be less stressed. If I could be less stressed, I would be less stressed. We don't fully live in an environment where that's an easy thing you can turn down, but you can choose what you're eating. And I think as you build a healthier diet, for someone who doesn't actively exercise, you build a healthier diet, you will feel better when you exercise. If you eat terribly and then exercise, you don't feel as good as if you were eating whole foods that are giving you the fuel you need to do that exercise. And then building up on exercise. And when you exercise and you're eating well, your sleep will improve. These are all three factors we have some control over. Sleep, I sometimes debate because, if you work shift work, that's a difficult thing to change. And if you can't sleep, or you're going through a phase in your life where sleep is difficult, it's really hard if someone looks at you and tells you to sleep better. And so I do try to avoid that. But I'm thinking these are two active things, food and exercise, that you can change. And I think food is a good one to start with. And when we talk about how important food is from an FMT standpoint, having a better diet going into doing FMT can help improve your outcomes. Post FMT, one of the biggest things we talk about with doctors is there's a post FMT lifestyle change. You have to eat better. You have to add an exercise. You have to prevent yourself from getting ill by looking at what you're putting into your body, because you want to stay healthy. And the longer after FMT that you're eating well and you're doing these things, the better engrafted and long lasting that gut shift will be. And again, as we talked about, that's really important for your health, as well as eating better and taking better care of yourself and feeding your body better than you were at the beginning can reduce the reoccurrences of things like C. diff infections or other infections in general, because your body is fueled better. So it's able to have a better immune response. It is less fighting itself because it's leaking into itself and causing inflammation patterns. So it can fight things easier because it's not fighting an internal battle, so it doesn't have any resources. So all of these things, they're stacking up. So going into doing, some kind of medical intervention, focusing on your diet as you're going into that can help your outcomes. Post something like FMT, ensuring that you're feeding your body to restore and keep what the benefits you've got, as well as thinking about what the impacts of diet and exercise have long term in supporting your health so you don't get sick. And all of these things kind of line up with we just have to do it. As hard as it will be to start small, make it fun, make it a goal, give it a number that you want to reach. I feel like sometimes we undervalue how motivated we are by success or reaching a goal. And you can trick yourself into that. If any overachievers out there, you tell yourself everything is due a week before, so you're always a week ahead, you forget. And you can make a goal and you can reach it, and you will get a little endorphin boost because you did the thing you set out for. So you can make it easy, even though it may seem difficult. And I think these shifts with government aligning with science is a really good period of time. And really, it underlines the importance of it. So we can no longer pretend this isn't important. It is so clear now, everybody's on board. But I think that we can't kind of undervalue that. And I think looking at the highlights and what are the most important here. I think we've made some good points about, eating whole food, eating across the top of the pyramid, and knowing that while some people may undervalue these pyramids, like I was saying to Jason earlier today, like the old pyramid from the 80s grouped eggs with dairy. And people, you can ask multiple people, go find 5 people and ask them if they think dairy and eggs are related, like are eggs dairy? Most people, they were around in the 80s, will think that because they were grouped together in the pyramid. So people truly believe if you go like, oh, I can't have dairy, they'll go, oh, it has eggs in it. You go, what animal does dairy come from and what animal does eggs come from? And then you see the aha moment. But because they were grouped in the pyramid, people put them together in their mind. So these pyramids do matter. These really do and can change a generation's view on how to eat and what foods are important. And so while it may seem minor that this is a new diagram and everyone's talking about what it looks like and why, it can impact on how the next generation will view food and how to eat. And where we're headed right now, the way that we are eating and the growth of chronic disease, we can't continue down that path. No matter how many new interventions we come up with, they're not sustaining life in a healthy, long set pattern. And we're seeing chronic diseases happen younger. There are diseases now that didn't exist or existed at such a low pattern we didn't talk about them. But I one of the big ones is non-alcoholic fatty liver disease. Literally, if you look it up, like the research doesn't start till recently because it didn't really exist.
Right.
The age at which people are showing that is getting younger and younger. And that has a huge impact on inflammation but as well, diet plays a big role there. And so we have to think about the bell is ringing because chronic disease is happening younger. So now we're having people living longer in these chronic disease states. So not only are if we're trying to extend life, but we're now seeing the impacts of chronic disease happening younger. So now you're living in this kind of suboptimal lifespan that is now longer, but the disease is happening younger. So I think this is a big shift happening at an important time because we need to change how the younger populations and the generations to come are eating. And we've made changes about reducing antibiotics, or at least flying the flag about the danger of antibiotics. But that only changes so much if people need them because they're getting sicker because they're not eating to kind of sustain health.
Right. Yeah, and I hope that as these changes are made at a higher level, that it starts to trickle down, right, to communities, to food programs, to school cafeterias, to university cafeterias, like these. To your point, that the idea that eggs would be considered dairy is an illustration of how people do look at these visual things and make associations, and it does stick. So yeah, I'm optimistic. Obviously, as a huge country of 300 something million people, this is going to take, as you said, probably a generation to really shift the mentality and thinking. But I think it's we have to make steps today because the path we're on is just not sustainable from a health economic standpoint, and just from a we care about people. It's just not fair that young kids are having to deal with these types of diseases that generations ago didn't even exist unless there was some other medical problems that were going on. Like kids should not be obese. Kids should not be having fatty liver disease. I mean, that is a real problem. And I think how we treat our children and how we think about our next generation says more about us than anything, right? Like it's pretty nihilistic to think like, oh, who cares about them? Like, no, we have to care about them. They're our future, as are we the future to our parents' generation and grandparents' generation. So yeah, I'm really optimistic to see this, and I'm happy we could discuss the microbiome component of this all, because in my mind that's potentially one of the most important aspects of this change is the impact that it can have on the microbiome.
Yeah. And if you're listening and you have a question or a comment that you want to add to this, please drop it below. If this made you want us to talk more about the diet or how, inflammation impacts disease, put it below and we'll add it to our next things to talk on list. And thank you always for joining us. And if you don't want to miss this, subscribe or push a button and do all the internet things. And join us next time for another exciting conversation about some way the gut microbiome is, being highlighted, or where FMT fits in disease. And we're excited that you are listening, and we hope that you join us next time. Thank you guys so much. See you next
Take
time.
care.